Good afternoon. This video is quarantine special edition, video number 11. Today I'm going to talk about chronic abdominal pain. On my another series of videos, list the problem alphabetically from A to Z. I talk about the abdominal pain with introduction of the organs and the locations and what kind of problem need to visit the emergency, what kind of problem can call a physician, make appointment as elective appointment and check out, and also what kind of problem can be managed at home. Today I'm talking about the chronic abdominal pain, which is quite common. We all have it once in a while from not eating fresh food, for example, or you drink very suddenly, not often, occasionally when you drink a very cold drink, your stomach starts to spasm, cause that uncomfortable feeling. Or you have chronic Crohn's disease, for example, which have been diagnosed, you know it, and your doctor told you what to handle it. Or ulcerative colitis is the same category. You were diagnosed and the abdominal pain is quite common and your doctor told you how to manage that. Today just briefly talk about the what kind of causes, where's location, and how to manage, and what kind of symptoms you really need to see your physician, even though you think it's not serious. It could be very serious. I'm going to talk about it. Okay, so if you have chronic upper gastric area and middle of upper abdomen pain, could be the gastritis, you need to check with your physician. Or the heartburn, like a GERD, you probably know it. Or the right upper quadrant could be the chronic cystitis or duodenal problem. If you were not diagnosed, and this occurred quite often, you better to go and to see your physician. Not emergency even though, but you need to call them. You tell them, I have the right abdominal, either middle or right upper abdominal pain, comes and goes intermittently for a while. It's dull pain or it's sometimes spasm, but just make me feel even nausea sometimes. If you had this, especially if you're eating not regularly or you're overweight, check it out, make diagnosis, and the doctor will give you advice what to do, either observe or take medications or surgery. And if you have left abdominal pain, it's likely caused by the colitis, like I said, just the non-specific cause, just the food irritate or something. You just feel pain here. The other one is the cause left upper abdominal pain, could be the chronic hepatitis, pancreatitis, not hepatitis. Hepatitis in the right. Chronic pancreatitis. It occurs quite often because there's some stones over there, small, sometimes clogged, and sometimes just open up, flushed out. So it also, there's some people had drinking alcohol for a while. You probably develop chronic pancreatitis, and this could be the remnant of the sequela after the acute pancreatitis, or some subtle cyst you did not know, from injury. So the variety of possibilities. Like I said, if you have the left upper abdominal pain, intermittently comes and goes, lasted for a while, you need to check it out to make sure it is nothing serious. And like I said, the colonitis, I already told, either ulcerative or the Crohn's disease. I'm sure it is occurred in special minority group, and you've been diagnosed, and just follow the physician's guidance. On the right lower quadrant, abdominal pain could be chronic appendicitis, not severe enough to remind you, oh, I have acute and I need to go for surgery, but just because the appendix is very small, not very well supplied with blood, so sometimes it could just have chronic inflammation. If that's the case, like I said, going for a while, you need to check it out. The other categories belong to female, has chronic abdominal, lower abdominal pain or pelvic pain. if it is constant, associated or not associated with your menstrual period, you need to check it out. Make sure there's nothing going on, nothing organic or disease going on. Then you manage it symptomatically. There's a special category, special disease I like to talk today is in elderly patient who had a disease like hypertension. There's called mesenteric ischemia. What is that? There's connective tissue wrap around the gut, okay, from the membrane structure to fix to fold small intestine. We have very long small intestine. If not folded well, we cannot hold in the abdomen. So this mesentery is the structure like a fan out to make the small intestine like wrinkled and condensed in the small cluster of structure. In between this membranous connective tissue, there are blood vessels to supply the small intestine. And those blood vessels could have the clot to block there. So this is called mesenteric artery ischemia. What kind of problem, especially you have older people, not pay attention to it. This kind of patient have abdominal pain with food intake. When they eat, because when you eat, your small intestine or stomach start to peristalsis, start to contraction vigorously and secretion, so probably need more blood supply. And then because the clot is there, you feel the pain. And if you touch it, feel it, you don't. If you touch it, you cannot feel the pain, but just with the food intake. So this patient gradually, because not pay attention, or food make me feel abdominal pain, I'm not going to eat. Gradually they will lose weight and getting weak and fatigue and even anemia. So I'm talking about if you have family member or if yourself is older than 65, 70, have other problems, if you have the symptoms I just mentioned, after eat you feel abdominal pain, but when you press it, it doesn't feel that much of pain. This kind of patient, you need to call your physician, and they will do the exam to make sure your the mesenteric artery is not blocked. Rule in or rule out. So this is the chronic abdominal pain I'm talking about today, and I hope it helps. Thank you for watching, and see you next time.